There's power in the factory, power in the land, power in the hand of the worker. But it all amounts to nothing if together we don't stand. There is power in our union. Now the lessons of the past are all learned with workers' blood. It's like so.
Hello everyone, my name is Elizabeth Manns and I'd like to welcome you to the April 4th Coalition Show. This is the July 10th, 2023 edition of the show. It is the 461st show that we have done since the closing of North Adams Regional Hospital and the first show since BHS's announcement of its possible reopening. The April 4th Coalition's mission statement is, we are for workers' rights and collective bargaining rights and are against tax breaks for the rich and corporations who ship our jobs overseas. We support all the articles of the Universal Declaration of Human Rights, but as is our custom, we put the emphasis on Article 23 at the start of the show. Dick?
All right. Section 1. Everyone has the right to work, the free choice of employment, to just and favorable conditions of work, and protection against unemployment.
Number 2, everyone without any discrimination has the right to equal pay for equal work.
Number 3, everyone who works has the right to just and favorable remuneration, ensuring for herself and himself and his and her family an existence worthy of human dignity and supplemented, if necessary, by other means of social protection.
And number 4, everyone has the right to form and join trade unions for the protection of his or her interests.
And as is our custom, we like to thank Michael Putnam, who is the program director for the community radio station, WMNB-LP 107.1, for airing the audio portion of our show on Fridays. And of course to David Fabiano, Nicole Brown, and the rest of the fabulous staff here at Northern Berkshire Community Television Corporation for helping us produce the show.
And today, Dr. Joanne Hurlbut is part of helping produce this show. Yes.
Okay, I did not know that.
Yeah.
Anyway, as you can pan out on the camera, we have extra guests today. These are our friends from the Northern Community Coalition Cares, I believe.
North County
Coalition Cares. It's
North
been
County
over,
Cares
It's been over 8 years since I've had to say that name or
Yeah.
even think about it.
Yeah.
And these are members. Dick and I have been part of both organizations, and we had some outstanding news over the past week, I believe, about a week ago.
Last Thursday, I think it was. A week ago Thursday, was it?
Yes, it was Thursday. It was right before I jetted away on my little vacation to Minneapolis. So yes,
And I was on the road.
you were in Nebraska, I
Yeah.
believe. When we received communication from, well, I got it on my BHS portal, but I also got it from the iBerkshires.com manager, Tammy Daniels, editor, Tammy Daniels, that BHS was announcing the possibility of reopening the North Adams Regional Hospital, hopefully sometime in the winter around January, if two things happen. They get their license reinstated from the state, and they're able to get the critical care access from the federal government, which prompted Dick and I to reach out to our friends from North County Cares Coalition to have their feedback along with ours.
Right, and we hope to do this for several weeks now, because this, to me, when I found out, I was driving in the car with my wife. We were driving back from Colorado, and my wife got a message from my daughter saying that it was announced that the hospital was going to reopen. And boy, it was just joyful. Just, I was driving down the highway, and every time I saw a hospital sign, when I used to see hospital signs, I used to think how sad it was that we couldn't have a hospital sign in North Adams anymore because we didn't have a full-service hospital. But then when I saw those hospital signs, I kept saying, wow, we're going to have those hospital signs set up again. All along Route 2, we're going to have an emergency room, a real emergency room. And I'm just excited, and I'm so glad to share this happiness with our guests. So we're just going to go ask Rachel to introduce herself and why, what interest she had in the hospital and what her reaction was to the closing and the announcement of the opening.
I'm Rachel Branch. I'm the creator and producer of Solutions Rising, and also part of the April 4th Coalition. Been a guest many, many times, and part of North County Cares Coalition from day one. I have huge family history for the North Adams Hospital, beginning with my great-grandfather. And in 1891, he dedicated a wing in the North Adams Hospital in memory of my great-grandmother, Harriet Marsh Gallup. She passed away at 31 years old in 1889, and it added 25 beds, which I think this is the number that is expected to return to the North Adams Hospital. I actually had stopped in to see Tammy Daniels, and she told me, I was almost in disbelief. I actually jumped up and down. I couldn't believe it, because all of us, particularly the core steering committee, we have all been fighting this, standing up, protesting, petitions, showing up, doing television shows since March 28th, 2014. And so 9 years later, to see some actual movement is amazing. But I also will be watching very closely to see what unfolds. A lot of questions.
Yeah. Marty, how about you? You want to introduce yourself? And
Sure. My name is Martin Greenstein. Most people know me as Marty, although my family, they call me Martin. And I was employed at the North Adams Regional Hospital from sometime in 2003 and officially retired in 2012, although there were times that I wasn't actually working because I was on disability for a while after an accident during a vacation, and but I came back as a volunteer when it was North Adams Regional Hospital, and I continued to volunteer when it became the North County campus of Berkshire Medical Center. I have very good memories about working at NARH. I was treated so well by the administrations and all of the employees who volunteered to donate sick time to me when I was recovering from my injuries. And I worked, I was the clinical social worker in the case management department and did an occasional shift or two on the Greylock Pavilion, the psych ward, and it was the best place that I have ever worked. Now retired for some time, and the news that it was going to be possible that it would reopen and gain critical CAH, critical access hospital designation. Thank you. Designation. I was delighted to hear that, and of course, the first person I called was Dick DeSati, and he was on the road coming. He was on the road driving. Was it Colorado? Was it
Might have been by then.
I was coming back, so I was from Nebraska or
Oh,
something
no,
like
you were, okay. You were coming back, but Dick said he was driving, but he reassured me that it was hands-free, because anyone who's driving and on the phone, I would be concerned about whether it's legal or not. So at any rate, he was the first person for me to call, and then, we talked a bit. We were both very pleased to hear this news, and so that's how I became invited to be on this program, and it is, I'm delighted with the prospect of maybe, into the winter or early in the new year, which would be like 10 years after North Adams Regional Hospital closed, but that would be a great step in the right direction. and I'm very pleased about it. And everyone else I've mentioned it to has been very positive about it as well. I live in Williamstown. Many people in Williamstown transferred their care to Southwestern Vermont Medical Center in Bennington. My wife and I did not do that. We continued, with the care through BMC and have been, reasonably satisfied with the care. And well, I won't say anything else about that, but this is great news. Thank you.
Thank you, Marty.
Rose, and I didn't work at the hospital, but I did work as a respiratory therapist in the community in Williamstown and also in North Adams. And when I heard about the closure of the hospital, it saddened me terribly. Just the thought of this community having to drive, especially all the way to Pittsfield, that don't have cars, and how they get there, how do they get back home again? Just a small thing. And how fast can the ambulance go? I mean, it's critical to have critical care beds here in North Adams. It's more than critical. I worked in many big hospitals in the Boston area, but when I came out here, I saw that the Greylock Pavilion was very good as far as my personal family. It was personal to me when the hospital was closing, because I felt that the care that was given here by the Breen Center and by all the nurses and psychiatrists on the Greylock Pavilion were very professional, helpful, and got me through some hard times and my children. But that's not just the only thing. That was just a personal thing of mine. I can't understand why anybody would want to close a small community hospital. And that's why I got on the committee to help reopen the hospital. I wanted to put my voice out there as somebody that worked in many hospitals and how important it is. And especially with the COVID, it would have been nice for people to have had, places where they could come in town rather than having to go to BMC and other places. I just feel, I don't know, it's like a sadness to have lost, these critical beds, because I've heard stories of people, that have lost, like one lady, she had a heart problem and she couldn't get to the Berkshire Medical Center in time, and now she has a permanent one. So it's critical. Time is so critical. It's the same thing when an ambulance comes to your house and there's a cardiac arrest. Time is so critical. 6 minutes and your brain starts, you might as well say it's gone. So that's why I feel that time is so important, as I've said 3 times.
Yep.
All right.
Anyway, well, I didn't get to say my part. I am Elizabeth Manns, and I'm one of the co-hosts of the show and part of the coalition. And when the hospital closed, I'm trying to remember where I was. Isn't this sad? I don't feel like I was working, so it must have been a day off. And I was stunned at the time. because it was not something I thought could happen, and having done enough research to understand why it happened, I wasn't thrilled. And I think the first words out of myself was, how could I stay out of this fight? This is not only a fight for me personally, but this is a fight for community, for the life of a community. This hospital was something that needed to be. And I couldn't, as much as I had said, oh, I've done all this other stuff, I fought for all these other things, this was one I couldn't pass up as much as part of me wanted to, because I was tired of fighting and standing up for causes. But this one I felt I had to commit to, which is why every week I've been keeping track and taping the shows, because I don't want to forget, ever forget, that there was a hospital up in Northern Berkshire, and that this community had a lifeblood that is now, and now I am cautiously optimistic, as I coined that phrase to Tammy Daniels when she called me, or actually emailed me, and I called her back. I coined cautiously optimistic because we're at the very beginning of it. But if it comes through, it will be a blessing beyond blessing. And for this community, for the people in this community, it will relieve one of the big stressors. And I honestly feel it will enable the finances, the economy, to pick up again in the Northern Berkshires. Will it come all the way back? No, but it is a good trigger to have. It will be a pillar back that we need to help the community recover.
Now, Rachel, you wanted to read from a book from...
Yeah, and I also just wanted to say that most of us here, all our families were born. I was born here. We were all born in that hospital. My parents, my grandparents, and the hospital had just put in a critical care unit, a new critical care unit in 2004. And when my mother spent the last 4 days of her life there, and 2 days in, there was a blizzard. If I had ever had to drive to Pittsfield, what would I have done? I can't imagine. So this affected us, like each of us are talking about, personally, just an enormous effect on all of us personally, plus what it did to the community and the jobs and the loss, the whole bundle of things. But one of the things, and he was invited, he couldn't come today, Dr. Paul Donovan, who wrote 3 historical books on the North Adams Hospital. But one of the things he said in his epilogue on his 3rd North Adams Regional Hospital historical perspective on the closing was, while one can speculate on the financial decisions that brought the hospital to close its doors, the bond debt that was accumulated between 1996 and 2004 was just too much to recover from. This large debt assumption for non-hospital real estate investments, unrelated to hospital services, unraveled the financial stability of the hospital. The hospital had weathered previous financial difficulties, but never to this magnitude. In the end, with no options left, the closure resulted. And this community kept that hospital solvent through a couple of financial crises for 129 years.
Yes.
So as I said, in Maynard Cedars, Professor Maynard Cedar was invited in his Berkshire book. It was a travesty what happened to this hospital, and it will take years, if possible, to bring it back to the place that it was. But this is also structural, systemic, our whole so-called
Society is built
healthcare
that way.
system.
Right.
Oh, our healthcare system is
There-
built to
right.
just make money for everything. It's
There-
not built to help the patient. I agree with that at this point.
During the 9-year anniversary, we ran a show and we took clips, and one of the clips was, nationwide, how the federal government had been encouraging hospitals to eliminate inpatient care to save rural hospitals and try to get more money from their, eliminate the beds and just have inpatient care and just get better reimbursements. But, then they would talk about how that's not what's necessary for a hospital. And what I think of most is, I can't remember the doctor's name, but the North County Cares Coalition invited a doctor who graduated from Williams College, and he spoke at Williams College, but he also spoke to us separately. He was from the UMass Medical Center. He graduated from Harvard University. And the one thing that he said, I don't know, Marty, if you remember this, but he said that I'm a doctor, and he says, and I have patients, and unless I have a pilot's license, I'm not going to practice medicine unless I'm 15 minutes from a hospital.
Right.
I'm not going to practice in an area without a hospital. And that's what happens when we get the critical care access and when we get that hospital opened up with 20 inpatient beds, that's going to provide a safety net for other providers to come to our community and serve, like birthing centers. Like we found out that, you know, we needed a birthing center, so we called the National Organization for Birthing Centers. And they said, well, in our rules, you have to be 15 minutes from a hospital for us to open up a birthing center. But in your case, in North Adams, we would probably give you a waiver. And that sounded good, but then when I started talking to midwives, they said, I don't want to practice anywhere that's that far from a hospital. I don't want to put my patients.
Or their professional license on the line.
Right, so this is big. And it's also big because when we look at the Universal Declaration of Human Rights, it says that everyone has the right to equal access to public services. And right now in Berkshire County, North County is the only part of the county that doesn't have a full-service hospital. South County has Fairview Hospital. To balance it out, North County, with as big a population as South County, should have a full-service hospital
And so
also.
does Pittsfield.
Yes.
Is that Central?
Yes.
That's central.
Yeah,
Central.
Also.
So we want to bring equity to Berkshire County, to the
And for
people.
Northern Berkshire County, you're talking about, what was it, 37,800 or over?
I don't remember
Over
the
37,000 people that lost their
Yeah,
services.
and
I
then
mean,
from
that's
southern
outrageous.
Vermont too. People in Stanford.
Yeah,
Reedsboro,
sure, because
they're
we're
not-
right
it's,
on
it's
the.
easier to come to us than to go to
Yeah.
Bennington.
But the
It's
other
easier for them to
thing,
go south.
before, and we all got involved on day one, before I got involved with North County Cares Coalition, I had no idea there were other financial arms to hospital systems. And I do not understand CEOs making millions of dollars. I do not understand why there are different financial arms of hospitals. It should be a break even. We just have to change. And you have talked to, we've all talked about universal health care. We have to change what is happening in this country because people from all sectors are, except if you're very wealthy, are not getting the care that they need. And
Yeah.
that's disgraceful.
We're very fortunate. In Massachusetts, there is a bill to set up a single payer plan in Massachusetts, and we're lucky. All the representatives and senators in Berkshire County have supported that single payer issue. And I think we're very fortunate.
I think we are, and we're probably fortunate because they learned from the experience of this closure up here in northern Berkshire County, how truly creaky or uneven the insurance system is and how it's
Right.
really not adequate to meet the needs of their constituents.
Right.
But what happened here is a precursor to what is happening across the nation.
Oh, it's
It
still
wasn't.
awful.
It wasn't that the need for the hospital was not necessary. It was the way the hospital was financed. And because some people have private insurance and other people are dependent upon government's insurance, the payments of the government wasn't enough to keep the hospital afloat because we were a poorer community. And that's not right.
It doesn't have any impact.
Right.
There's no
It
reason.
shouldn't have any reason,
Right.
it shouldn't impact patient care.
Right.
Because all doctors are sworn to take care of their patients and by the Hippocratic Oath. But that administrator of that hospital is not sworn to that oath.
Right.
That their job is to keep the hospital solvent and
cut
to make
costs.
profit.
A few things that
Be fair.
we've come across through the years thinking about this issue, and we've dealt with it quite a bit on this show. But one I can remember Michael Wilbur always saying, and too bad Michael couldn't be here today.
Can't because of the flooding.
Yeah, but Michael always said that if there was one employee on that board of directors of North Adams Regional Hospital, an employee representative on that board, he said they never would have closed it, because I think it has to be a unanimous vote. But if that one employee, if there was employee representation on the board of directors of the hospitals, I think there would be better input for the services to the community. And the other thing would be, we talked about, is that nonprofits in Massachusetts, maybe we should set up a law that the highest paid person in a nonprofit organization can't make more than 12 times the amount of the lowest paid person in that organization, to keep the
Where'd
income.
you get 12 times? I'd say, like.
I don't know, I just said
What?
8.
You just
5
picked that
times.
one.
I
At one
picked that
point he
number
was-
myself.
At one point he
In
was
Mondrian-
advocating 7 times. At one
Right,
point he was
Mondragon, it was
advocating
eight times. But I mean, that help, and I talked about it in a letter to the editor when Mass College of Liberal Arts was talking about opening up one of their dorms as an emergency shelter. I talked about one of the key things, problems in our society is income inequality. In like the homelessness, the closure of hospitals, they're all a secondary effect to the fact that people aren't earning enough money when they're working hard. They're not making enough money to have a living wage. And if everyone was, then we would be able to support hospitals and all the other services that we need in our community.
In fact,
Right.
it would eliminate some of them. It would eliminate the need for food stamps and
Right.
housing subsidies.
And I just say,
Right.
this is the
And all the
United
other
States
things.
of America. We shouldn't have anybody sleeping on the street, anybody homeless, anybody hungry.
We shouldn't have
anybody
hospitals.
needing health care.
Right, we shouldn't have hospitals closing. And I remember recalling the time when we had the bank crisis in 2008, that they said the banks were too big to fail. And I think hospitals are too big to fail.
I think
that
they're
we
too
should not
vital.
let hospitals fail. We're not measuring. Our economic system doesn't measure all the benefits that a hospital. They're just looking at dollars and cents, if there's a profit or not, or the neoliberal thing of if it's paying for itself. That shouldn't be the issue. The benefits far outweigh the
North
costs.
Adams did not let, our community did not let this hospital fail for 129 years. Everybody in the community, whether they had, I don't know, balls and food, all kinds of things to raise the money that was necessary to keep this hospital solvent.
And I'm hoping that we will do the same thing with Berkshire, when BMC opens up North Adams Regional Hospital again. If the community can gather together and support that hospital like we did in the past, and we'll know what it means to be without one, and we'll commit ourselves to support that hospital and keep it open. We have less than a minute left, so if anybody has any final words that they'd like
Power
to say.
to the people. And let's be cautiously optimistic and watch.
And watch.
I want to thank Gail Caridi.
Oh, yes,
Wonderful.
I really do.
yes,
She was wonderful during the whole time
absolutely.
that we met. I mean,
Dearly loved and dearly missed.
And-
Dearly missed,
And
yes.
we also had State Senator Ben Downing.
Ben Downing,
Having
the
to
only
thank, he fought
elected
hard.
person
Yeah.
that stuck with us and tried to help.
And right now, I'm thanking our whole Representative Barrett and everyone else that's fighting for it right now.
Yeah.
I
Thank
think
you,
we're very,
everybody.
thank you very much.
Sorry, I had to cut you there. There we go, all right.
There's power in a factory.